Coming up on Network Africa, Africa declared free from wild polio by the independent body, the Africa Regional Certification Commission. South Africa records its lowest number in new daily COVID-19 infections since June. Plus, talks in Mali end with no decision on the transitional government. Hello and welcome to the program. I'm Layo Adegoke. We begin today with the announcement from the Africa Regional Certification Commission, who has declared Africa free of wild polio. Nigeria was the last African country to be declared free from the disease, having accounted for more than half of all global cases less than a decade ago. 2 out of 3 strains of wild polio virus have now been eradicated worldwide. More than 95% of Africa's population has now been immunized. This was one of the conditions that the Africa Regional Certification Commission set before declaring the continent free from the virus.
August 25th, 2020 marks a huge day in the history of the fight against polio. After 4 years without a case of wild polio, the WHO African region has finally been declared free of wild polio virus. We must continue to protect Africa's children against all forms of polio and other childhood diseases, ensuring they are protected by immunization. And we must take the lessons learned and best practices from eradicating wild polio virus to achieve Africa's other public health goals and improve healthcare for all Africans.
Because we had to reach every child, we had to know exactly where that child hasn't been reached with the vaccine. It was not an easy journey. We had to rely on getting data, reliable information, analyzing that information, and then coming up with specific innovations, strategies and approaches for us to ensure that we reach the children despite those challenges.
While the continent may be free of poliomyelitis, but thousands of people across Africa still live with the effects of the disease. But these sufferers have welcomed this latest development. All 47 countries of the WHO's African region have now eradicated the crippling viral disease that attacks the nervous system, causing irreversible paralysis within hours.
28-year-old Bimisola Ijibamigbe, a wheelchair basketball player and para-swimmer based in Nigeria's commercial city Abuja, contracted polio aged 11 months. She says her childhood was blighted by the emotional pain of wearing oversized clothes to hide her difficulty in walking.
Go! 1.
I started wearing very big clothes because I thought that could cover how I walk, but obviously it can't cover it up. So I was wearing very big clothes. I was trying to be a tomboy at the same time, trying to, mask up all my emotions that, whatever you say doesn't get to me and all that stuff.
Children under 5 are the most vulnerable to polio, but people can be fully protected with a vaccine. Usman Yusuf, a member of Nigeria's National Association of Polio Survivors, who contracted the disease aged 3, said he looked forward to polio's eradication.
We are affected and we don't expect our children and our younger ones to follow the same route.
To keep the virus at bay, population immunization coverage rates must be high, and constant surveillance is crucial. Misbahu Lawan Didi contracted the virus at the age of 2. He's now the chairman of the Association of Polio Survivors and also a UNICEF ambassador for polio.
I will appeal to them to continue cooperating with the government, to continue cooperating with the international partners to continue with the vaccination is the only protective measure. It is only way that we are sure Nigeria will no longer have child with polio in our country.
For Gwemisola, she is happy that her children will not have to go through the emotional pain she suffered growing up. Flipping through her training pictures and videos, the sociology graduate, who is also a model, says no one with polio should give up on achieving success in life.
Polio is not a death sentence. I'm here, I'm standing, I'm here, sitting. So polio is not a death sentence. Anybody that is suffering from polio it's even a stepping stone for you.
Well, earlier on, we spoke to Dr. Faisal Shuaib, the Executive Director of the National Primary Healthcare Development Agency. He spoke about how this is a massive achievement for the continent. He also talked on why Nigeria was the last country on the continent to get a polio-free certification.
Africa will be certified polio-free. It's massive, it's huge, it's a momentous and unprecedented news for all Africans. This is the first time ever that all Africans and the global community will be again certifying another region as wild polio virus free. Eradicating wild polio virus is significant because this will be the only second virus in the history of human beings that will be eradicated from Africa. The first one was smallpox, and now you have the white polio virus. So it is very, very important, and all of the efforts that have gone into bringing us to this day has spanned almost 3 decades. So it's been 3 decades of so many heroes along the line, such strength of character of the average Nigerian, right? The never say die spirit of the average Nigerian has brought us to this momentous occasion. It is also significant because what we're doing is sending a very clear message across future generations, an enduring message, an enduring gift to future Nigerians that no Nigerian will ever be threatened or will ever face the potential of being paralyzed or killed by the white polio virus. So it is very, very important. So today, not just Nigeria will be certified polio-free, it's the whole of the African continent, but only a few months ago, the African Regional Certification Committee also cleared Cameroon, Central African Republic, South Sudan as also polio-free. So this is very, very massive. One of the reasons why we've sort of delayed in getting to this stage has been because of the insecurity in the Northeast. You will recall because of the insurgency in Borno and parts of Borno State, it was difficult to access kids in those local government areas, those communities that were held as a result of the Boko Haram insurgency. So accessing kids with oral polio vaccine made it impossible because of insecurity. Besides that, you will recall that in the mid-2000s, there was a time when some northern states actually suspended oral polio vaccination because there was this concern that oral polio vaccine has anti-fertility elements. But of course, all of that has been dispelled, and working with traditional leaders, religious leaders, we've been able to march forward. But in recent times, there's no doubt about the fact that it is the insecurity in the Northeast that delayed our journey towards white polio virus certification. The same thing is happening in Pakistan and the war-torn areas of Afghanistan, where you see the crisis between the crisis areas between those countries has been the one responsible for churning out wild polio viruses. But in Nigeria, what we've also seen is that when in 2016 we suffered that setback, President Muhammadu Buhari showed leadership by making the resources available, 9.8 billion naira that he gave to the polio program, and say, go to Borno, make sure that this outbreak doesn't expand, but beyond Borno, make sure that every part of the country is able to use these resources to increase routine immunization, to protect all kids in Nigeria from the wild polio viruses. The leadership provided by the Honorable Minister of Health, Dr. Osagi Ehanrie, shines through, because when we had this setback, he also went from state to state to engage with the governors to advocate for more resources. The traditional leaders, Alhaji Aliko Dangote, Mr. Bill Gates, our development partners, our donors, they made a huge difference in making sure that we became resilient. We're able to use all of the data that is required. Frontline data, frontline technology was very, very instrumental in getting us to this stage.
Well, it appears the COVID-19 cases in South Africa is declining as the country recorded 1,677 new cases of coronavirus, the lowest number in daily infections since the month of June. The cases declined from a peak of around 15,000 daily infections. However, experts have warned that the current decline in new infections is not an indication that the worst is over. Some 3.5 million tests have been conducted in the country since it recorded its first case in the month of March. Experts are also warning that the risk of infection remains and the people should stick to the health guidelines, especially social distancing. Well, Libyans are bracing for a surge of coronavirus cases as numbers rapidly rise in the country where years of chaos, division and war have left the health system in ruins. Doctors in the eastern region are warning that poorly equipped hospitals will not be able to withstand the sharp increase in cases.
With over 200 confirmed cases in Benghazi, doctors in Libya say there are not enough beds or ventilators available to patients, and civilians are not following the guidelines in place to help contain the spread.
We have about 200 beds for suspected cases and about 30 beds in the ICU. We also have about 40 beds for confirmed coronavirus cases. So if numbers exceed those figures, we won't be able to cover them, unfortunately.
Across the North African nation, municipal leaders and doctors are saying the situation is out of control, demanding that the government makes wearing masks mandatory and issues an emergency rescue plan to deal with the outbreak. According to El Hassi, most of those infected in the east contracted the virus from attending large gatherings without adhering to social distancing measures or wearing masks. But the conflict has put a strain on the liquidity of banks, decreasing Libyans' purchasing power, with many struggling to afford masks.
Medical staff, whether medical assistants or those on the front lines, either in Benghazi or other cities in Libya, need assistance. They need to support us. People need to listen to the advisory committee by ensuring social distancing, by wearing masks, by using disinfectants, by washing their hands and not going to gatherings, malls, weddings, funerals, or anything of the sort. They need to know that the virus is real. The casualties are real. The deaths are real. They need to support us.
Last month, Libya's internationally recognized government imposed a curfew in areas it controls, and authorities in Benghazi also imposed restrictions on movement. Libya has been torn apart by waves of fighting since the 2011 revolution that ousted Muammar Gaddafi, fragmenting the country into areas controlled by warring factions.
Let's take a look at some politics now coming from Mali. Talks between West African mediators and the military coup, I beg your pardon, the leaders have ended, but without any decision on the makeup of a transitional government. Discussions were on for 3 days. Now, the West Africa's regional bloc dispatched negotiators to Mali over the weekend in a bid to reverse President Ibrahim Boubacar Keita's removal from power last week. Diplomats say talks had focused on who would lead Mali and for how long, rather than the possibility of reinstating President Keita. The coup has raised the prospects of further political turmoil in Mali, which, like other countries in the region, is facing an expanding threat from Islamist militants. Well, VOA's correspondent Naba Mohidin joins us now on the program from Khartoum. Hello, Naba. Thank you so much for speaking to us.
Thank you, Liv.
Now, what does this state visit by U.S. Secretary of State Mike Pompeo, what does this portend for Sudan?
For Sudan, it might show the desire for Sudan to involve in the international community after being isolated for 30 years. And also, it's part of U.S. elections campaign as Donald Trump, the U.S. president, is the maker of this peace deal, Israel with Arab countries peace deal.
All right. And do you think that the country will get its wish for removal from the list of terror sponsorship? That is one thing Sudan is looking for from this visit. Do you think that could happen?
I think it might happen, but it's too early to happen because it's linked to another main issues. But it's paving the way for Sudan to show its desire to be discussing the vital and important issues in the world and be part of the peace deal. So maybe it's paving the way for the removal, but it's definitely not only the issue for the removal, but it might be a very good case for the diplomatic discussions between Sudan and between U.S.
And in what other areas do you see this new relationship between Sudan and the U.S. government, especially after the overthrow of President al-Bashir? And why is Mr. Pompeo promoting closer ties between Israel and Arab countries?
Actually, regarding Sudan, because Sudan is an important country for Africa, as it's an Arab, Muslim, and African country. So this mixture makes it a key for other countries to accept the peace deal between Israel and Arab countries. And also, as I said, it's part of the U.S. Campaign for upcoming elections. It's very soon. For Sudan and U.S. relationship, maybe it will be so good as Sudan is trying to get rid of the heritage of the former regime, and it's giving a new situation or attitude regarding the important issues regarding the peace, regarding removal of the terrorist image that the former regime has been doing for the last 30 years. And that he is happy to fly from Israel to Khartoum with one flight, one go, without any stations between like before. And for now, the transitional government, the AFFC, and all of the government bodies, they are expressing optimism regarding the talks, and also with the Bombay visits, there is the Prime Minister of Ethiopia visits. So I think August is really important and a turnover in Sudan regarding the transition and regarding the relationship with the international community.
All right, then Naba Mohidin, VOA's correspondent in Khartoum, thank you for speaking to us.
Thank you.
Nigeria's Speaker of the House of Representatives, Mr. Femi Gbajabiamila, has implored on speakers of parliaments of other African countries the need for debt cancellation for the continent from their multilateral and bilateral partners. Mr. Gbajabiamila wants the conference to become a more regular occurrence since he is seeking to establish a body that will facilitate increased collaboration between speakers, heads of parliament and national assemblies across the African continent. He made his wishes known as he conversed with speakers from across the continent. To the topic at hand, he said there was an urgent need to join local and global efforts to push for the cancellation of the external debt owed by various countries on the continent.
It is safe to say that the burden of debt servicing, vis-a-vis spending on education and healthcare, for example, is a threat to our continent's stability and development, especially in the era of COVID-19. When we find ourselves having to make policy choices between paying debts or saving lives, we know something is not morally right. And as the democratically elected representatives of our people, we cannot be silent. We must speak up and we must act, and the time to act is now. Furthermore, is the need for us to reflect on, one, the processes that led to Africa's heavy indebtedness in the first place. Two, the role parliamentarians can play to address this going forward. And three, what assurances we as parliamentarians can give our borrowers that if our debt is cancelled, the freed up resources will be invested in social and economic development of our citizens. If we want debt cancellation, we must be able to build the confidence of the borrowers that the cancellation will indeed save lives and livelihoods across the continent. And we as speakers and heads of our parliaments will ensure that it is indeed the case.
Well, at the end of that conference, it was decided that Nigeria hosts the maiden edition of the Conference of African Speakers and Heads of Parliament, COSAP, chaired by the Nigerian speaker, and for the body to meet again first week in September to approve an agenda. And that's where we end Network Africa today. Thank you so much for watching. I'm Layo Adegoke.